Who is most at risk for RSV infection? Imagine catching a virus that can hit anyone, but some people are more likely to get really sick from it. That's especially true with respiratory syncytial virus, or RSV. It's a common virus that causes cold-like symptoms, but in certain groups, it can lead to serious lung problems. So, who are these groups? Let's find out. Infants and young children are the most vulnerable, especially those under 6 months old. Babies born prematurely or with lung issues like bronchopulmonary dysplasia are at higher risk. Kids with congenital heart problems or neuromuscular disorders that affect their breathing are also more susceptible. Children with weakened immune systems, whether due to illness or treatments, face increased danger. Kids who attend daycare or have older siblings in school are exposed more often, raising their chances of catching RSV. For children under 2 with developmental or neurological conditions, the risk of severe illness is higher too. Older adults are another key group. People aged 65 and older often have weaker immune defenses and are more likely to develop complications. Adults between 50 and 70, with chronic health issues like heart disease, lung conditions such as asthma or cystic fibrosis, diabetes, or obesity, are also at increased risk. Those with neurological or neuromuscular problems that impair breathing are more vulnerable. Residents of nursing homes or long-term care facilities are especially at risk because of close living conditions and shared spaces. Other factors that can increase risk include living in crowded or low-income households, exposure to tobacco smoke or indoor air pollution, and not breastfeeding infants. A family history of asthma or allergies can also play a role. Living at high altitudes and being male or having multiple births are additional factors noted in some studies. RSV spreads easily through respiratory droplets when people cough or sneeze, and it can linger on surfaces. Infants and immunocompromised individuals can stay contagious longer, sometimes up to for weeks after symptoms go away. Because RSV symptoms can look like the flu or other respiratory illnesses, testing is often needed to tell them apart. Preventive measures like monoclonal antibodies are mainly used for high-risk infants and children. Older adults and those with chronic health conditions should be especially cautious during RSV season, which usually runs from fall through spring. Both RSV and influenza tend to circulate during similar times of the year and affect similar vulnerable populations. They can cause serious lower respiratory infections, making it important to recognize who is most at risk. Always consult healthcare professionals for personalized advice and proper management. Understanding these risk factors helps us protect those most vulnerable and reduce the impact of these respiratory viruses on our communities.